Here today with Glenn Silver from Finn Partners, and Glenn and his associate Laura were presenters at the HITLAB Innovator Summit today.
Yes,
so can you tell us a little bit about what your presentation about and how you think it was received?
Well, we surveyed reporters in the health IT space, which to us made a great presentation because we were actually able to use the feedback they gave us to talk with people here at HITLAB. Mm-hmm. And not too surprisingly, artificial intelligence, AI, was on top of the list in terms of what they want to be covering in the not too distant future, but also where they see as being the biggest source of confusion or misunderstanding. Reporters talked about how there are concerns that artificial intelligence in healthcare may replace actual services from the provider, mm-hmm. how it may sacrifice security. Also, they felt that artificial intelligence, wasn't at the level where it can actually make a big difference in how they receive their health care. So there's a lot of opportunities both with the mainstream and the professional media to inform and make sure that the information they're using is accurate and reliable.
Yeah, well, and there's a lot of really good individual stories in the room, and to be able to tap into that as examples to maybe dispel some of the misconceptions that might be out there could be a pretty powerful message.
Absolutely. I mean, the best part of being here is having access to some of the best minds. And not only do we rely on them to talk about what they're doing, but we also love to hear about what frustrates them, what keeps them up at night. And these are things that we like to incorporate in our media relations approach at Finn Partners, mm-hmm. telling the complete story, not just give information that reporters want to hear, but giving them information that's critical for them to hear in developing their stories.
Mm-hmm. So did you swap a few phone numbers and collect a few business cards today?
Oh, absolutely. Laura and I are always good to do that. Again, the beautiful part of these networking events is becoming acquainted with new people and hearing new stories and getting new perspectives. So we're always open to that.
Mm-hmm. So you have a unique insider's view of this particular world that is remarkably vast and diverse. And it would seem that we are at not necessarily a critical juncture, but we're certainly witnessing a revolution that's taking place right now.
Yeah, it's get comfortable with it, embrace it, or be left behind. Sometimes my 20-something kids say the same thing to me when I'm asking them basic questions about social media, but it's really true. Artificial intelligence, whether it's directed to heart disease, whether it's directed to wearable technologies, whether it's related to how one healthcare professional shares information with another, it's here to stay. And we as healthcare consumers need to start embracing it and asking questions that help us better understand it and utilize it. And those are the type of stories I believe that reporters on the consumer and also on the professional side of things are very, very eager to hear.
Mm-hmm. So we've had some people sit down in that chair over the last day and a half who have fabulous ideas and innovations. And we talk about them, and they reveal at the end of it that it's really the first time they've ever said out loud what they've been carrying around and obsessing over in their heads for as long as a decade or more. And really what you do is to help them kind of hone that and refine that and make it the effective tool that it can be.
Absolutely. We work with them in a variety of different ways, primarily to communicate with their target audiences. And those target audiences could be investor, the street, it could be other healthcare providers, it could be pharmaceutical or medtech companies that they want to partner with, or it could even be the patients themselves. There are so many critical audiences that are part of the communication scheme for these companies that, a good and thorough conversation is needed, and strategy is at the heart of their success.
Mm-hmm. Sounds like a sounds like a fun job right now and a really good place to be.
You know, I'd love to say that there's a typical day for us, but depending on the client, depending on their needs, and depending on what's going on in the media landscape, there's so many different ways that the day could play out. I love my colleagues, and one of the best things about our group is that we consider ourselves, you know, students. As much as we're experts, our ears are always open to learning more. And it's through that accumulation of knowledge that we come up with some really cool and innovative strategies. And our clients love to hear that.
Yeah.
Out of the box thinking.
Yeah, good work. Glenn, thanks so much for coming by and
My pleasure.
sharing your thoughts with everybody.